right, well, tonight we are talking about future generations, and we're going to talk about nourishing healthy children from conception to, I think I put adolescence on there, but life, basically. And this is a subject that I'm really passionate about myself. And if anybody has kind of followed the Weston Price Foundation, you know that that's really the main goal of the Weston Price Foundation, is to create a better world and to educate people so that our children can be healthy and kind of inherit the earth, right? And that's kind of what Kathy was talking about. So I want to start by talking about the state of health right now. And for children, it's not good. 1 in 3 kids are overweight. 1 in 3 children born today will have type 2 diabetes if it continues on its current track. 40% of children have allergies. Why? Why, right? Antibiotics are prescribed 2 times as needed. I think that's an underestimate. 11% of children are diagnosed with ADHD. That is up from 3% in 1997. Autism, 1 in 49 boys, 1 in 189 girls. As I was putting together information for this to kind of let all of you guys know what's going on, I found this study that was published in the Annals of Allergy, Asthma, and Immunology. And we talk about this a lot in our practice. We always say if you suppress a symptom, that symptom will always reassert itself in another direction. And everybody knows this. If you go on one medication, chances are you're going to be on more medications, because medications aren't getting us better. What are medications doing? They're suppressing our symptoms. And those symptoms will reassert themselves in other directions. And so boys newly diagnosed with ADHD, a disorder, these boys aren't healthy, that's why they have ADHD, are 40% more likely to have asthma, 50% more likely to have needed a prescription for allergy medication, and 50% more likely to have a bacterial skin infection than other boys. This is serious stuff. Okay, so Dr. Price went all around the world, and I'm going to show you some of the pictures of the children that he met all around the world. So the first place Dr. Price went was a small village in the Laurentian Valley of Switzerland. And in this valley, they were completely isolated. The only thing that they brought into their town was salt. And he studied their teeth. And this was the first place that he went where he had found a really, really healthy, isolated traditional culture. And he was blown away when he looked in their mouths, because he found less than 1% tooth decay in these people, even though they had no access to dentists and they did not brush their teeth. He said they had a kind of a slime over their teeth, but they were perfectly straight with no decay. So they were straight too. They had nice wide palates, good broad faces. So here's what we're going to talk about tonight, and the subjects we're going to talk about, and you know, I'm going to give you principles for when a child is growing to live by. We're not going to get into specific issues. We're not going to get into allergies or ADHD or anything like that. I'm going to give you principles that you can follow. And we're going to start with preconception, because these traditional cultures started with preconception. They had the knowledge, they had the wisdom, without any doctor telling them, that they needed to get their body right and they needed to have good nutrition. Then we're going to talk about birth, infancy, and then moving forward into childhood and adolescence. I just love this quote. The production of healthy babies indeed constitutes a partnership between ourselves and the Creator. God provides the blueprint, the genetic code, while we, the parents, provide the building materials. And so that's the first thing we're going to talk about. How do we prepare ourselves? The first thing that we do is we avoid things like anti-nutrients. And any of you guys who are patients here know that I harp on sugar all day long, and if I find out that you've even eaten a little bit of it, I yell at you. So the first one I want to talk about is sugar, and this is what kids are eating, but if you're even thinking about having a child, you have to prepare. By the way, does anybody know how long your body needs to prepare for a child? A woman's body?
2 years before.
2 years. All of the traditional cultures practiced spacing of children, and they were never less than 2 years. So you need time for your body to replenish itself and get ready for a baby. So the big ones I want to highlight on here that we definitely have to get rid of is one, sugar. When we eat a molecule of sugar, can anybody tell me how many molecules of magnesium it takes to metabolize that molecule of white sugar? 56. So sugar literally pulls nutrients from your body in order for you to digest it. So that's the first thing we got to give up when we're thinking about having children. And by sugar, I mean any refined carbohydrate, white flour, white pasta, white bread, things like that. And then we've got trans fatty acids. What are trans fatty acids in? Come on, guys, you know this. They're in fast food, vegetable oils, industrial oils, so things like canola oil, soybean oil, corn oil, stuff that they use in restaurants, things like that. So we avoid that kind of stuff. Soy products. Soy products are estrogenic, and so they mess with your hormonal system. So we get those out when we're thinking about having a baby. Caffeine, irradiated food. So cod liver oil is the first one. Oops, sorry, I'm going to go back here for a second. And during pregnancy, we advocate 2 teaspoons of cod liver oil a day. If you're getting ready for having a baby, a teaspoon a day. Next thing, full fat foods. When Dr. Price studied these traditional cultures, most of their diet was fat. And what we know now about fat is that fat does not make you fat. Fat does not cause heart disease. In fact, when your body's burning fat for energy, it produces far less free radicals. Your hormonal system is much healthier. Your immune system is much healthier. And then plus, it contains the fat-soluble vitamins, A, D, vitamin K2, all of which are crucial in the formation of a healthy baby, but also crucial in the absorption of minerals. So really, really important to do high-fat, good high-fat foods. So we've got coconut oil on here, pastured eggs, beef, chicken, liver. The most common sacred food among the traditional cultures that Dr. Price found was liver. It's an extremely nutrient-dense food. Second, fresh, wild seafood. Oh, and if you're eating meats, they have to be pastured. They have to be outside eating grass. Because when an animal's outside eating grass, it's getting trace minerals from the grass, it's getting vitamin D from the sun, and then when we eat that animal, we get that good nutrition. Wild seafood bone broths. How many of you guys are making bone broths? Awesome. Great source of calcium. And by the way, this is the food that the traditional cultures ate. Lots of calcium, amino acids, collagen, gelatin in bone broths that are healing to the digestive system. Collagen are the building blocks of our body, the building materials. So that's what we want to eat preparing for a baby. Lacto-fermented vegetables. Oh, yes, go ahead.
Do you have recipes for bone broth?
Oh, yeah. Yeah, we have a whole lecture on bone broth. I could talk for hours about it. I won't. But yeah, we can get that for you. Lacto-fermented vegetables. Why is this so important when we're getting ready to have a baby?
You increase the good bacteria in your gut when the baby passes through the vagina. It collects that.
Absolutely. You know all about that. Yeah, it's so important. Did you guys know that even just one dose of antibiotics, your microbiome is never the same after that? Even one dose. And how many rounds of antibiotics are kids getting? Every time they have the common cold, they're getting an antibiotic. It's a major, major, major issue, and we're seeing tons of problems with it. Now, unfortunately, women who are thinking about having children have been on lots of antibiotics in their life. So you have to work really hard at getting a good microbiome that you can pass on to your child. We're going to talk a little bit more about that in just a minute. Fresh vegetables and fruits, properly prepared grains, which we're going to give you an example of tonight, and unrefined salt, because it has trace minerals in it. So a lot of women don't really worry about what they're eating when they're pregnant. They just take a vitamin, a prenatal vitamin. It's normally like one tablet that they take a day. And they say, oh, I'm fine, I have my prenatal vitamin that I'm taking. You want to always try to get your nutrition from food if you can. And as you're glancing through there, I wrote each nutrient that's in a regular prenatal vitamin, and then the foods next to it that provide that same nutrition in a natural form. Anybody notice anything common about the foods that are on there? It's all fatty foods, right? These are the most nutrient-dense foods there are, and these are the foods that the traditional cultures ate. These were the sacred foods that they ate that Dr. Price studied. Then probiotics, of course, naturally fermented foods. So thinking about having a baby, want to get healthier, here are some supplements that we can do. Unfortunately, most of us haven't eaten the diet of a traditional culture. We aren't, our nutrient stores aren't quite what they should be. So most people do have to supplement in addition to eating a really good nutrient-dense diet. And so what we have up here is cod liver oil. The studies done on cod liver oil are amazing. In Norway, cod liver oil during pregnancy was associated with 70% less risk of type 1 diabetes. In Finland, 10,000 infants between 1966 and 1997, so this is a longitudinal study done over many years, found that it virtually eradicated the risk of type 1 diabetes over 30 years. And then not to mention that it contains omega-3s, and it contains DHEA, and it contains vitamin D, all needed for good formation of an embryo, and then also brain function. So this is the stuff that doctors are telling women not to take. And it's so hard for me because I have women, I say, take cod liver oil. Oh, my doctor told me not to take that. Oh, how do I explain in the 5 minutes that I have that your doctor's wrong about that? You take the cod liver oil. So that's the first thing, 2 teaspoons when you're pregnant, 1 teaspoon when you're getting ready to have a baby. If you think you're really deficient, you can do 2 teaspoons. I do that some days. So that's the first one. The second one is a really good whole food multivitamin. We have Catalin up there. Catalin's been around since the 1920s. Every time they've discovered a new nutrient like B1, you know, all the B vitamins that they've discovered recently, they checked Catalin for it, and guess what? It was already in there because it's whole food. Trace minerals are so absolutely crucial to development and the function of all of your cells. Enzymes that get every reaction going in your body need trace mineral cofactors to function right. So we've got trace minerals on there. Calcium lactate. Who here got cavities when they were pregnant? Anybody? You didn't. Your husband's a dentist. A lot of women get cavities when they're pregnant. Why do they get cavities when they're pregnant? They don't have calcium. The baby's leaching the calcium from their body and they get a cavity. And so, you know, maybe they're not eating healthy too, but deficiencies in calcium will cause cavities when you're pregnant. And then I have zinc liver chelate on there. Both men and women can use zinc. Trick when you're taking zinc, it can make you nauseous. Take it with food if you take it. So these are kind of the good ones if you're preparing to have a baby. Now birth, the next step. We want to do a natural birth if possible. I know it's not possible for everyone. You know, a lot of us, I was born to a mother that was deficient in vitamin A. I have a heart defect. A lot of us are born to mothers whose pelvis didn't form properly because their mother didn't have the right nutrition that they needed. And so C-sections happen. They happen. We want to avoid them as much as we can. And one of the best ways to avoid a C-section is to not let them give you drugs prior to childbirth. And I know it's scary, but if you can avoid an epidural, if you can avoid the Pitocin, those things lead you towards C-sections. And C-sections, of course, really impose problems for the baby, which we're going to talk more about in just a second. You focus on healthy gut bacteria. We're going to talk more about that in just a second also. Breastfeeding if possible. I have a really cool picture I'm going to show you guys about this. Lots of cuddle time and adjustments to the nervous system. We can't listen to those doctors that said don't love your child. It's required for the nervous system. So lots and lots of cuddle time. We pick the baby up when he cries. All of the evidence is leading us in that direction. So, oh, it's not going with me here. There we go. That's the one I wanted. So this is really interesting, and I actually saw this at a seminar that I took on the microbiome of the human gut recently. What we have here is what the bacteria looks like in a vaginally born breastfed baby versus a vaginally born bottle-fed baby and a C-section baby. And so the vaginally born breastfed baby, their gut microbiome looks a whole lot like their mother's gut microbiome. You inherit that from your mother. And it's very rich in good bacteria. It has a nice diversity and full of good probiotics. The vaginally born baby, but was bottle fed, theirs doesn't look quite as robust as the vaginally born breastfed one, right? And it's not, but the C-section baby looks very, very different than the vaginally born baby. The C-section baby's gut microbiome resembles the bacteria that's on the skin of the hospital workers and on the surface of the hospital bed where it comes out. Isn't that gross? So these poor babies develop way more problems than a vaginally born baby do. And, especially if their moms don't focus on good gut bacteria, which we'll talk about in just a sec. But they develop way more problems. They are much more likely to be obese because of the way the gut microbiome changes the way we metabolize sugar and our metabolism in general. They're more likely to have things like allergies and asthma and ear infections and things like that. So we want to avoid that whenever possible. And again, the best way to avoid that is to not take drugs going into a pregnancy like an epidural or a Pitocin. Now, say you have a baby and you cannot avoid a C-section. That happens. What do? You breastfeed if it's possible, and you really focus on, for that baby's life, giving it really good, naturally fermented foods that are full of good bacteria. Last month, I showed everyone that was here how to make sauerkraut. It's really, really easy. And so if you have a baby that was a C-section, who would eat the sauerkraut? You would, because it's going to be on your nipple. The good bacteria, it's going to go through your breast milk. Kefir, the list goes on and on. Naturally fermented vegetables. And we have whole tutorials that we do on that. And of course, you avoid antibiotics if possible with that child, and you take a focus on a healthy gut. And so it's not kind of it's over if you have a C-section. You do everything that you can to make sure that child's healthy moving forward. So we have our baby, and we do everything that we can to have a natural birth. And we breastfeed, and we eat a really, really healthy diet, make sure we're getting lots of nutrient-dense foods so that baby can grow and develop properly. But eventually, we're done breastfeeding, right? And we got to introduce food. Now, everybody knows the first food that everybody introduces, right? It's cereal. That's what they tell everybody to introduce. That's the scientific advice of the day, cereal. Well, cereal should really be the last food that you introduce, because when you start introducing food, the baby's gut microbiome starts changing. And the very first foods that we should introduce are foods that are high in healthy fats, high in fat-soluble vitamins, and really easy to digest. So I have this chart, and any of you who are patients have probably seen this up on my wall in my treatment room. And you can order this. I can get the name for you. It's on the Weston A. Price Foundation website. And so what this basically goes through is the very first foods you can add and when you can add them. And their first food is cod liver oil. And that's what the traditional cultures did. And you can do that at 4 to 6 months. So first food's cod liver oil, then runny egg yolks. Egg yolks are super high. They have vitamin D in them. They have B12, B6, choline. They're just amazingly nutritious, especially if it's from a pastured animal, which we have pastured eggs here. And then you can do bananas at 4 months. No vegetables yet at 4 months. And then at 6 to 8 months, we can do butter. We can start doing broth, cooked and strained avocados and fruits and things like that. And we can start doing some fermented vegetables. Not raw vegetables yet because their little digestion can't handle it. We can do fermented vegetables at that age. 8 to 12 months, we can start doing naturally fermented milk kefir, whole plain yogurt, full fat, of course, and then raw fruits, and then they can do steamed vegetables. Now their little system can tolerate steamed vegetables. And it isn't until over a year that we introduce things like grains into their digestive tract because they can't digest them until over a year. And we talk about the disorders that kids have that are running rampant: allergies, ADHD, autism. The common thread amongst all of those childhood disorders is digestive issues. That's the common thread. And our gut microbiome, we know there's a gut-brain connection. It protects us from the outside world. It helps us live in the world. And when the gut microbiome is off because we introduced a food too early, or we were a C-section, or we didn't get the right food, or we got sugar too early, well, we start being more sensitive to the environment. We get allergies, and we get sick more often, and all that kind of stuff. So we want to think about that. Now, then, once the kid is on food and they're starting to grow, then we follow the principles of a healthy diet that Dr. Price laid out when he studied these traditional cultures. And here's what he found. It didn't matter where he was in the world, whether he was in Alaska or Switzerland or Africa or the South Sea Islands. All of these cultures that were the healthiest people on earth followed the same principles. And it was obviously no refined foods. They ate pasture-raised animals. And they ate some of their animal foods raw, like their egg yolks or their milk, because there's certain nutrients that you can't get when it's cooked, like B6. They had nutrient density. They ate food that was dense in nutrition, like liver, and those sacred foods that we were talking about. They ate some raw foods. Their food was high in enzymes and beneficial bacteria. They kept their guts healthy. They weren't on antibiotics, lucky. I read recently that there's certain bacteria that the human gut microbiome is supposed to have that's becoming extinct because of antibiotics. Properly prepared grains, which we're going to do in just a second. To properly prepare a grain, we soak it or we sprout it. We unleash the nutrients in the grain. We get rid of the indigestible parts of the grain and the anti-nutrients. High in healthy fats, high in omega-3 fatty acids as opposed to omega-6 fatty acids, which the American diet is very, very high in. Omega-3s are in things like fatty fish, grass-fed beef, pastured chicken, pastured eggs, unrefined salt, and then they utilize the bones. And one characteristic that every single one of these cultures had in common, no matter where he was in the world, was that they made provisions for future generations. They taught generations how to prepare the food. They were careful to eat the right foods when they were thinking about having a child. They gave children the right food so that they could grow up strong and they could have the right building materials to fulfill their genetic potential. So what we're going to do next is we're going to make some pancakes. We're going to make buckwheat pancakes. And I'll answer any questions while we're getting this ready. Okay, so we're going to get started. What I have here are buckwheat groats, and this is what they look like. They look like a little pyramid, like a little triangle. And the reason I'm starting with buckwheat groats is they're just less expensive than buying the buckwheat flour. And you have a 75-pound bag, don't you, Tim? Yeah. 50 pound. Oh, okay. So it's not very expensive. You can get it in bulk, and it's really, really easy to make flour out of it. So what we're going to do is we're going to take 2 cups of the buckwheat groats, and we're just going to blend it up. And you don't have to have a Vitamix. You can have like a regular.
And you do this before you soak it?
Mm-hmm.
Okay.
Yeah, you make it into flour. So. simple as that. And you can use a regular blender for this. Hey, Tim, I actually need another bowl. Did Natalie? Oh, did she? Okay. So it's really easy. Vitamix does it really fast. And actually, I'll just add it to this. So the next step is that we're going to add water and apple cider vinegar to this. Now, can anybody tell me why we want to soak it overnight? I need a bowl, actually.
Oh, sure.
Why do we want to soak it?
Does it release the enzymes?
Yeah, whenever you have a anything that's a grain or a seed, what you want to do is before you consume that food, you want to introduce it to a warm, acidic environment. And what that's going to do is going to activate the enzymes that break down the indigestible parts of that grain. So what you're left with is you don't have the anti-nutrients that damage the gut and pull nutrition away. What you're left with is the really nutrient-dense, wonderful parts of the grain. You know, grains are good for you. There's a reason that people eat grains. They have got lots of B vitamins in them. They're good for you. They just have to be digestible in order for you to eat them. Thanks, Debbie. Okay, so you'll just take that flour and pop it right in a bowl. And then you'll add, so we had 2 cups of buckwheat groats. Then you'll add 2 cups of water.
How much will this make?
A lot.
Yeah.
It makes a lot. And then you add 2 tablespoons of apple cider vinegar. I use apple cider vinegar because it's awesome. It has good bacteria in it too. So 2 tablespoons of that, and it doesn't taste like vinegar. You guys will see in just a second. We have some for you. 2 tablespoons of that. And you just whisk it all together to get a nice little batter. And what you're going to do, I always make this the night before I'm going to make pancakes. And then you just leave this on your counter. I put a paper towel over it on the counter for the next morning. It's as easy as that. So then the next morning, you have your batter ready to go. So this is one that we've already soaked overnight. And what we're going to, and this is what it'll look like, guys. It looks kind of thin when you do it, but that's what it'll look like. And then, so we have one that we soaked overnight already. And what we're going to do is get this ready to cook. And so we're going to add some stuff to it. We're going to add, these are all in 2s, so it's really easy. 2 cups water, 2 cups buckwheat, 2 eggs. Okay, so throw an egg in there. And then we're going to add baking soda. This is really important. The baking soda is really important to get a fluffy pancake. And so we're going to add, we have the recipe for you guys. It's 1.5 teaspoons of baking soda. I'll just do half. And then these next ingredients are optional. I add them because it makes it much more delicious. Oh, salt. I'm sorry, you have to add salt to it. 1.5 teaspoons again of salt. Okay, and then I add vanilla to it. Just makes it taste a lot better. You want to not have to use as much maple syrup as people like to use on this. So I actually add a bunch of vanilla. I'm going to add a teaspoon or a couple teaspoons.
Are you just putting regular vanilla in it? It shows here vanilla stevia.
Vanilla stevia is optional. I don't put that in mine. That's if you want it to be a little bit more sweet. Well, I'm sorry?
Tastes like cake when you put that in there.
It's pretty good. And then cinnamon. And it's just a bunch of it. I hate measuring when I cook, but a bunch of cinnamon. Makes it taste really good. And then I do a splash of heavy whipping cream to make it extra delicious. If you have a problem with dairy, you don't have to do that step. And then we just whisk all of that up. And then, oh, it's okay. Hey, Natalie, can you pass around the pancakes?
Absolutely.
So you whisk all of that up. And I like to cook mine in coconut oil. I like to put a bunch of coconut oil down and cook it, and then I put butter on top of it. So a bunch of coconut oil to cook it, and then butter on top, and it's...
Are those on phase 1?
No. No, these are to feed healthy growing children who need carbohydrates.
So
But-
if you see us cheat and we're on phase 1, you'll look the other way.
Yeah, that's right. When I eat my pancakes, I put unbelievable amounts of butter on them. It's like ridiculous.
Well, it can't hurt you that small.
I'm going to be good because she's watching.
Good job.
Oh, I just, that was the first carb I ate in a month.
So these last in the fridge. I mean, you want to, when you make this batter, you want to make all the pancakes from the batter right away, because this goes bad really quickly. And it just turns sour and you don't want it.
freeze them? Do they freeze well?
I don't, Debbie, did they?
Oh, yeah.
Yeah.
Have it on my-
Yeah. I mean, I keep mine in the fridge and like for the whole week, and then you just eat them. And then whenever I make them, I put at least a tablespoon of butter on them, because then you don't have to use a lot of maple syrup, and it's just delicious. Exactly. And they already have lots of coconut oil in it because you cooked it in coconut oil, and it's just delicious. And you guys can smell it too if you want in a minute. Pretty good, right? Nice and fluffy. I don't think kids can really tell the difference between that and a regular pancake that they're used to. So,
Will there be, can you put honey in there instead, or?
like on it instead of maple syrup?
Well, yeah, or in the mix when you're.
I don't know if I'd put it in the mix, but you could use honey instead of maple syrup if you want.
Yeah.
Or you could put no maple syrup on it at all.
Are kids really not allowed to have honey before a year of age?
I don't know. Does it say it on there?
Yeah, I mean, doctors tell you no honey.
Oh, do they? They tell you not to have have food that's not pasteurized. That's probably why.
Honey has botulism in it, so that's why we say no.
Yeah. Then no.
Then no.
I don't have kids yet, obviously. So what we have here is just a couple other things that you can do to raise healthy children, and I'm going to pass this around. This is a little lotion that we made with shea butter, coconut oil, and lavender essential oil. You don't need a lot of this, just a little bit, and it's an amazing lotion. It soaks right into your skin, and it smells great. So you pass that around. You guys can try that.
Is there a recipe for that?
I can post it on Facebook.
She can post it on Facebook. It's super easy. It's super easy. You just we've got the tubs of shea butter in the store. We've got the lavender in the store. We've got the coconut oil in the store. You just melt it together. It's super easy. So then we have supplements that kids should do. We've got tuna omega-3 chewable fish oils. These have a great little flavor. It's kind of like a strawberry flavor, and they just pop it and they get the oil in their mouth and it tastes good. And then they can chew the gelatin capsule.
What is the age range for that? Because I have older children.
I mean, if they'll swallow cod liver, I'll give that to them.
Okay.
Yeah. If they won't, then you give them this. Then we've got chewable Catalin, which is the multivitamin we talked about. And this tastes like cherry again. And then chewable Conjuplex. Conjuplex is a combination of calcium, lactate, and thymus gland to give kids when they're sick. This stuff works amazing. You just keep giving it to them. Their fever will go down. It's awesome. And then we have this Inner Eco probiotic that's flavored. My little nephew is staying with me for a week recently, and he has all these digestive problems, and he loved this. It was like a treat. I tricked him into doing a probiotic because it tasted great. And it's seasoned with stevia. That's how they make it sweet. 1 tablespoon of this has 100 billion good bacteria in it.
What age can you start that?
What do they say? I think at any age, it's food. Yeah, it's food.
Is there any benefit to taking more than 1 tablespoon at a time? You sit there and
I do that sometimes. You might have diarrhea after that, but just be careful. It'll clean stuff out. You might have a detox reaction if you do that.
Like 2 tablespoons at a time and stuff.
2 tablespoons might not do that. If you drink the whole thing, maybe it would. But yeah, I think it's a good idea to get as much in there as possible. The reason this is so much better than like the powdered probiotics or the ones that you take is because this is food. And so it lists like 8 different probiotics in here, but this has way more than that. It has lots of strains of good bacteria, and everybody's microbiome is different. And so you want to make sure that you're getting the good microbiome, the good bacteria that your microbiome needs. And then we have kids' toothpaste. I was watching my niece and nephew, like I said, and I was horrified by the toothpaste. I thought my brother and sister-in-law knew better than that, but they had the fluoride bubblegum junk, and I almost didn't let them do it, but I didn't want to be the mean aunt. So, but this is a good alternative, and if you're not already using natural toothpaste, it's so much better. And so we have alternatives over there for adults too. We have alternatives to mouthwash, all that kind of stuff. And then Debbie wanted me to show you guys these. We have these in our store. These are little beef and veggie bars. And these have fruit in them too, and these are nice little snacks for kids because they're eating, I was watching them and they like wanted a granola bar every 5 seconds. So kids need calories. And so if you can give them really good, healthy, individualized snacks, these are a great place to start. And we have lots of other stuff in our store, just like this. All right, guys, have a great night. Thanks for coming.